Okay, thank you very much. Good afternoon. I hope that everybody was able to enjoy their weekends in a safe and responsible manner. Dr. Williams is currently attending other meetings, so I will quickly summarize the latest trends and open it up for questions. Over this past weekend, we saw 106 cases on Saturday, 81 on Sunday, and today we're reporting an additional 99 cases of COVID-19 in Ontario, which brings our total to 40,745 cases. Of these, 91% are considered resolved. Today, 29 of our 34 public health units have confirmed 5 or fewer cases that are new today. And 21 of our health units report 0, no new cases today. Ontario is reporting no new deaths today, and only 3 deaths reported in the last week. Our new cases today, the 99 cases, are concentrated in 3 health units: Toronto with 26, Peel with 25, and Ottawa with 19 cases. Our testing levels remained high over the weekend. Today we're reporting 25,567 tests have been completed, and of those, 0.7% were positive. So what does this mean? I am very encouraged that our numbers of cases have remained low, especially as most regions in Ontario have been in stage 3 for over 3 weeks. Overall, the provincial rate continues to go down, and we have seen the number of hospitalizations and deaths remain low and fairly stable. But, as I have said before, the higher risk businesses and services that are permitted to reopen in stage 3 means that everybody has to continue to follow public health advice and workplace safety guidelines to avoid outbreaks. We're asking everyone to be more vigilant on personal protection, physical distancing, and adhering to their social circles. The better that we all do in stage 3 means that less COVID in the community, and therefore less COVID in congregate settings, including our schools. So please continue to act responsibly and respectfully to keep family, friends, colleagues, and neighbors safe. I'll now turn it over to the media for questions. Thank you.
We'll go to our first question. First question.
Your first question comes from Heather Wright with Independent Petrolia. Please go ahead.
Good afternoon, Dr. Yaffe. Last week, Dr. Williams mentioned that he had been talking to his colleagues at the long-term health table to reconsider allowing families back into nursing homes. And I wonder where that stands now. When will the rules be changed?
Well, the visiting policy was changed a few weeks ago, and we are continuing to review the data and work together with long-term care to see if there are any changes that will make sense based on the data and the evidence. So at this point, I don't believe any changes have been made, but we're continuing discussions.
Follow up.
Thank you. There have been only 3 cases since August 8th in 90,000 residents. That's about 0.5% of all the new cases. There have been 6 cases in workers in that same time frame, which is about 0.9% of all the new cases. So what is the threshold for case counts to allow families back into long-term care?
I don't know that there's a threshold. I agree that those numbers are very low, which is great. But we also remember this is a very vulnerable, high-risk population. And so I think a very kind of risk-averse, conservative approach is being taken to the visitor policy. As I said, we're looking at the data in terms of the frequency of asymptomatic testing, what needs to be done if there is a case, and trying to balance the risks of COVID with the risks of social isolation and mental health. So it's an ongoing conversation.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Brian?
Hello?
Oh.
Dr. Yaffe, my question is about the school reopening. And we keep hearing that we've got boards and teachers' unions and parents' advocacy groups saying that the provincial reopening plan puts students and teachers at risk. I'd like to hear from you on your thoughts regarding that.
Well, I think that we have to put it in context. I mean, back in March, we were the first province to recommend and to close schools because of COVID. And so we are taking it very seriously. We have gone through increasingly incremental measures, public health measures, starting with very basic things like hand washing and hand hygiene and not going out or going to work if you're sick. Moving on to, opening certain establishments, stage 1, stage 2, and now stage 3. And all along, the basic public health measures are really what's important. Making sure that people don't go to school or don't go to work if they have symptoms. Get tested if appropriate. Social distancing. If you can't stay 2 meters away from somebody, wear a mask. Those are very basic things. Hand washing, having easily accessible hand washing facilities. Quick access to testing. So reopening schools is something that we know is very important. Pediatricians have very strongly recommended it in terms of the mental and social health as well as learning for children. There's never any situation with absolutely zero risk. So what we're looking at is implementing public health measures to mitigate the risk, and then if there is a case, to make sure it's dealt with as quickly as possible to reduce spread. So I think that those are the basic things I would say. We obviously, cohorting is important, and making sure that everybody, including teachers, parents, other staff, and kids, are aware of what their role is and what they need to do to keep themselves and others around them healthy.
Follow up?
So, Dr. Yaffe, you mentioned basic measures that we can all take, and you've been advocating those from the beginning. Those are the measures that have been at play in areas such as retail, where be it grocery stores or pharmacies or even the LCBO, those have remained open throughout COVID-19. We have not seen a dramatic spike in workers from these establishments who see thousands of people a day walking through. And yet teachers are going to have far more measures in place to protect them than retail workers. So are teachers somehow, because they're dealing with children, between 15 and 25, maybe as high as 30 children, are they somehow at greater risk for contracting COVID-19 than someone who would deal with hundreds to thousands of customers per day?
It's really hard to say. It's very situation specific. Certainly, we are always monitoring the evidence, the literature, the experiences across the world with COVID-19. The experience generally has been children under the age of 10 either tend to not get infected or have very mild infection. It has been believed that they are less likely to transmit, although I realize there has been some recent data that may be otherwise in terms of the viral load in their nose and whether that in fact is significant for transmission. I think that basically what we're looking at is, again, using the basic public health measures, cohorting as much as possible so that if, despite all the measures, there is a case, it's very clear who the person has potentially exposed, and we can follow them up really quickly. So I can't really compare, a worker in a retail store with a teacher. But I would just say the basic public health measures are important in every setting.
Okay, I don't believe we have anyone else in the queue, so that'll be it for today.
Okay, thank you.